I also co-direct the Stanford Parenting Center with my colleague, Dr. Elizabeth Becher. Today's webinar is our first of our fall 2021 Positive Parenting During COVID-19 series hosted by our Department of Psychiatry. Dr. Emily Ock will be giving the second webinar of this series on parenting through uncertainty, talking with children about illness, death, and other topics we'd rather avoid on October 7th at 12 p.m. Pacific Standard Time. Next slide, please. For a deeper dive into this topic, Dr. Ock will follow up her free webinar with a parent psychoeducational class that will have a cost with scholarships available. Next slide, please. We also have a parenting an anxious child class being taught by Kyle Cassidy as well, coming up this in September. Next slide, please. And then we also have an upcoming mindful parenting 8-week class that will continue to be online starting in September. Next slide. And then there is also an upcoming mindful teens 8-week class that will also be online starting September 21st for ages 13 to 17. Next slide. For more information on these classes, webinars, as well as to access our previously recorded free webinars, please visit our Stanford Parenting Center website listed here. So next slide, please. So now let me reiterate a very warm welcome to everyone who's joined us today for our webinar. We're so very fortunate to have Dr. Kendra Reed, and I'm thrilled to be able to introduce her. Dr. Reed is a clinical psychologist, the director of the Mood and Anxiety Program, and director of anxiety programs at Seattle Children's. She received her Ph.D. in clinical psychology from Temple University in Philadelphia, Pennsylvania, under the mentorship of Philip Kendall, and completed her postdoctoral fellowship here at the Stanford University School of Medicine in the Psychiatry and Behavioral Sciences Department. Dr. Reed specializes in the treatment of youth with anxiety disorders and OCD from a cognitive behavioral therapy perspective. Her research interests include understanding factors that contribute to treatment outcome and the dissemination and implementation of CBT for anxiety disorders. We'll spend the first portion of the webinar on the presentation, and then we'll have time for questions afterwards. Please submit your questions through the chat function located at the bottom of your screen. And now I'll turn it over to Dr. Reed. Thank you.
Thank you so much, Dr. Kurahashi. It's an honor to be here speaking with you all today about something that is near and dear to my heart. Just getting youth back in the door and helping them cope with the COVID-19 pandemic. So first off, I just want to disclose there are no conflicts of interest in relation to this program or presentation. Next slide. Okay, so as we start talking about what getting youth back in the door to school during the COVID-19 pandemic, I felt it was really important to acknowledge that we are all in the same storm, but we are not in the same boat. So this pandemic is affecting different groups of people disproportionately. Next slide. So just wanted to take a moment to talk about equity and inequity during the COVID-19 pandemic, because as we start to talk about interventions and getting youth back to school, I just want to have some of these ideas in our mind to frame how we approach interventions for different groups of people. So what we know is that COVID-19 has disproportionately impacted communities of color, seeing that there are much higher rates of mortality and even COVID-19 cases for Latinx, Indigenous peoples, and BIPOC communities in general. And we see, death rates skyrocketing differentially for BIPOC communities compared to white communities during this pandemic, and that this has affected youth too. So what we see is that Black and Latinx youth are 4 to 6 times more likely, respectively, to test positive for COVID-19 than white youth. And youth of color are overrepresented among those that are hospitalized. And I just want to note that these numbers change all the time, especially given the Delta variant. So it's possible that these numbers look really different if we were to survey nationally now. And we know that our resources for gathering these numbers are biased. So it's likely that these are underestimates of what's actually happening. Next slide. And I just want to note that, again, that COVID-19 has disproportionately disrupted the safety and stability of communities of color relative to white communities. So we see really disproportionate rates of unemployment, significant job disruptions for adults, increased stigma, harassment, discrimination, and even violence against groups, particularly Asian communities. So next slide. Why are we talking about this in relation to mental health? This is key as we start to think about how we intervene for youth, given that these interventions necessarily will include BIPOC youth. So we need to acknowledge the fact that the objective risks are different for different communities. So that's really important for us to consider, especially what we're going to talk about today in regard to like facing fears or getting out to a public setting, like going to school in person. So this is kind of like a framing thought that I want to keep in the back of all of our minds today. We know that there are pre-existing mental health disparities. So we see that there are similar rates of mental health concerns, but greater burdens of disability, more persistent symptoms, and fewer mental health resources for BIPOC communities than compared to white communities. And what we're seeing is sort of an interaction of these concerns. With there being greater objective risks and interacting with the pre-existing mental health disparities, we are more and more concerned about the differential impact of the mental health cascade for BIPOC communities of youth in particular, because that's our focus today, is the youth. Okay, next slide. So when I mentioned the mental health cascade, what did I mean? So we are anticipating that there may be some long-term mental health impact on youth because of COVID-19 related restrictions and just the whole pandemic experience. So things like worry about contracting the illness, isolation due to quarantine restrictions, impacts on social determinants of health, like caregiver employment, food security, that sort of thing. Impact on developmental trajectories, increased caregiver stress. A lot of the parents that we talk to are impacted very greatly by what's happening. And often decreased access, and particularly before youth were transitioning back to school in person, we're seeing decreased access to typical mental and physical health resources, often that were school-based, but we could extend that to thinking also about things that were more available in the community as well. So a lot of families experiencing less access to the resources that might help them in this situation. So today we're going to be talking a bit about, like I said, getting back to school in the middle of a pandemic. And I just wanted to frame that one of the biggest emotions that tends to come up as we talk about this is anxiety. There are other big emotions for sure. There are lots of other big emotions that anyone might experience. So I just want to take a moment to say, like, we are in the middle of a global pandemic. So if you or your child is experiencing a big emotion at this time, of course you are, especially anxiety. Anxiety is in the words that we speak to each other. It's in the air constantly. So it's in the make sure you stay 6 feet apart, make sure you wash your hands after this interaction, make sure you put your mask back up. It's in the air all the time. So it makes complete sense if anxiety is coming up for youth at this time. I want to say it's not guaranteed that it will come up for every youth, and it's not necessarily signaling a problem if they're not experiencing anxiety. But as it comes to returning back to school, this is something that we're seeing as a big indicator of concern. So a note about anxiety from the top. anxiety is our body's natural alarm system. It's normal, it's adaptive. It is not something that we want to get rid of or quote cure. If we did, kids would be ending up at the hospital for a different reason because they would have walked into traffic or done something else without regard to like the very real risks of the world. I often like to use sort of like a smoke alarm analogy when I talk about anxiety. So, thinking of the smoke or fire alarm that we all have in our homes, uh, often we've had the experience where that's gone off just because someone's been cooking and hasn't gone so well. Uh, and in my old home, the smoke alarm would go off every time somebody took a shower, which probably pointed to some other problems that were going in that house. But the point is that the same sort of thing happens with our body, where anxiety, as our body's natural alarm system, is going off when there's no fire, when there might be, some steam or, you know, a minor inconvenience that isn't an indicator of a need to evacuate the house, so to speak. Uh, and the problem is that when this alarm is going off, a lot of times anxious youth are, metaphorically evacuating the building. They are avoiding the thing that is anxiety provoking and not sticking around long enough to see, like, wait a minute, might this be a false alarm? Might this alarm be a little bit too sensitive for the situation? So what we want to do is help youth to recalibrate the alarm. We don't want to remove the batteries. And I think this is also important to consider as we talk about anxiety in the context of what is a very real threat, COVID-19, a global pandemic, right? And especially given everything I was talking about before, where there are more objective risks for certain communities. So we really want to stop to evaluate, hey, what are the actual risks in this situation? What is our objective information before we make assumptions that either, on one hand, totally evacuate the building, totally avoid, or on the other, move forward with abandon, like without regard, without, safety measures in place or something like that. So our goal is to gather information in the situation, knowing that anxiety tends to shortcut that. It tends to make us jump to conclusions that overestimate danger and underestimate our ability to cope. So that would be our goal in these situations. Next slide. Okay. So I'm going to primarily be speaking a bit about our approach to anxiety before we start to apply that to school-based situations. So there are lots of different flavors of anxiety, so to speak. We tend to use this term more ubiquitously. And I just like to break it down because understanding the specific drivers of concern for youth is really important when we start to think about, like, how are we going to help them address this situation? How are we going to help them do the thing that they need to do or want to do within reason, within the safety precautions, given the pandemic? So I use this analogy that there are a lot, like anxiety is kind of like ice cream, that there are a lot of different flavors. And actually, it's pretty common for people to have more than one scoop of ice cream. Sometimes you just have like a little taster spoon. So it's not like meeting necessarily diagnostic criteria, but there's just enough there, just a taste. I don't know if I've taken this metaphor a little too far, but we eat all flavors the same way, or the intervention is the same regardless of the flavor. So here's some of the common themes I've been hearing about, for years, but have really often been amplified because of this pandemic, and that I have been seeing as drivers of like difficulty, quote, getting in the door to school as families consider going back in person. So as you might imagine, one of the big drivers is worry about health and safety. So a lot of concern about germs and contamination because COVID, right? Makes sense. And this has been a concern in schools for a long time for the youth that tend to come into my clinic, but we're just seeing this totally amplified. Like I said, anxiety is in the air. We are constantly messaging about germs and contamination during a pandemic. So this one is understandable. It makes sense how we got here. We are also seeing increased concerns about separating from primary caregivers or other safety figures, because for many families, they have not had practice separating from each other for a long time. And it might feel very strange. It might just feel out of practice. We might be really worried that something bad is going to happen to ourselves or our family members if we separate from each other. We've kind of hunkered down in our bubbles for so long that it's hard to think about popping them. Another big worry is just about re-engaging socially. I mean, this one's kind of like if you take time off from the gym and then you try to go back and bench press or whatever it is that you do. I obviously don't go to the gym that much, but you try to get back to the same level of exercise that you were doing before. It's going to be tricky to do that. You're going to feel out of shape. And so we're seeing this sort of feeling come through in social situations a lot, right? Like, oh, I'm just feeling super awkward. Like, how do I interact with people in person again? More anxiety about like, I'm going to do something embarrassing. I'm going to make a social mistake. I'm out of practice. What do people even say to each other? Because, our only interaction so far have maybe been over FaceTime or something like that, or over like some sort of typed interaction, like texting, where we have more time to consider our responses. It's not happening in real time, and we're not having to think about like our body language or other people's body language that helps us to communicate with each other as well. And we also might see some other themes around like worry about grades, doing well enough in things, especially as we get back to being in person. And maybe some of the, academic rigor pressures of, being in the school buildings return. A lot of concerns around the unknown. And I know Dr. Ock has a whole presentation about this coming up in October. But intolerance of uncertainty is a big theme for the anxiety world. And arguably, this is something we deal with every day. None of us know what's going to happen in the next moment. And can be a big driver of anxiety for sure. And just failure in general. Worry that I'm going to just totally fail this school thing. I'm going to accidentally break the safety precaution rules. I'm going to fail at that. I'm going to fail socially. But that's just another big theme that we hear a lot. So I wanted to take a note to think about what anxiety can look like, because especially as families start to think about getting back into school, a lot of these behaviors might pop up. So of course we see just some of this more like abject avoidance of just like not doing something, not going anywhere near it. So not speaking, or not even going into the classroom, avoiding school altogether, perhaps. Sometimes avoidance is a little more subtle in that it shows up in the form of overdoing something in order to avoid a specific outcome, like overdoing homework, redoing work over and over again in order to avoid failure or imperfection, or overdoing the reassurance seeking questions to avoid encountering uncertainty. So just to note that sometimes avoidance can be kind of subtle in that way. We often see a lot of body reactions and complaints. So stomach aches, headaches, shakiness, feeling hot, cold. And as you might imagine, the kids prone to more anxious somatic reactions, those body reactions, were often the kids ending up in the nurse a lot before a global pandemic. And if we have the framework of this illness that's going around, that like, what if you catch it? I really want to highlight that we feel anxiety like we feel all other emotions throughout our entire body. Sometimes we forget and think like emotions are just something that just happens in our head. We feel them throughout our entire body because they are a product of our brain. Our brain is connected to, the rest of our central nervous system. We feel it everywhere. So it's common for youth to confuse those physical symptoms of anxiety with illness, and having some good information about like what would be indicators that like maybe I'm feeling anxious versus what are some indicators that like, what if I have COVID, right? The symptoms tend to be fairly distinct. But it would be important to just note that we can feel anxiety throughout our bodies. Because youth might experience a physical symptom of anxiety and then experience a big spike in anxiety because they're like, whoa, does that mean I'm sick? What does this mean? Because of their worry. We often see sleep and eating difficulties, right? So trouble sleeping alone, frequent waking, eating less, avoiding eating in the cafeteria, especially if we think about, the pandemic and how we're going to eat with our masks and how that dovetails with contamination concerns. As I mentioned, we often see excessive reassurance seeking. So that would be youth checking in a lot about rules or dates, or arrangements that we would expect them to remember what's going on, because I always pick you up at 3:30 because that's when school ends, but you're asking me every day, when are you going to pick me up? Who's going to pick me up? Are you definitely going to be there? Are you going to be right in that spot by the tree? And so I would keep an eye out for that excessive reassurance seeking. And we could talk more about how to differentiate appropriate reassurance seeking, especially at a time of great uncertainty in the world, from this more excessive anxiety driven type, if people are interested. We know that anxiety impacts the attention system, because if you're worrying about lots of stuff, it's hard to pay attention to what your teacher is talking about. So this can impact school performance. We might miss things. We might not realize we had homework in a certain area. So sometimes anxiety presents in this way as inattention or poor school performance. Like I mentioned, we see just straight up school avoidance. And then often we see that, we see some of these bigger angry outbursts as youth try to avoid the thing that's anxiety provoking. If you think back to that fight or flight system, a lot of kids choose the avoidance route, but I'll see a lot of kids not choosing, but kind of defaulting to this fight system of having a big emotional reaction, a big behavioral outburst within the context of something they find anxiety provoking. Next slide. Okay, so what do we do about it? So I just wanted to give some framework for the general ideas of how we target problematic anxiety for youth, as we then before we then talk about applying that to school-based settings. Next slide. Okay, so here are some top tips. I think the key thing, and especially if we think about going back to school, is just to hear where they're coming from and to validate their emotional experience. They might be feeling a lot of different ways about the idea of going back to school. Some of the kids I'm talking to are super excited about it. They can't wait. They're like, this totally stunk this past year and a half of being home. I can't wait to get back in the door, see my friends, just do school in person like regular. Some kids are really scared. Some kids are kind of indifferent, or some kids might be feeling sad about leaving, being so away from their dog for so long during the day. There are so many different emotions that they could be experiencing. So we just want to give some space for all emotional reactions to be okay. Just and the best way you can do this as a caregiver is just to say, yeah, I hear you. You're worried. You're feeling sad. Just to repeat back the feeling words that they're saying. And if they're not saying the word, but they're showing you with some behavior, I would say something like, it seems like you're feeling pretty angry, or it seems like you're feeling pretty scared about that. It then opens a conversation, and they have an opportunity to correct you if they're like, actually, I'm not scared, I'm super pissed that you're making me go back to school, or whatever the situation is. And this also gives you a moment to tie those physical experiences of the emotion to the emotion itself, so that we can clear up any of that confusion around misjudging those somatic or body sensations of an emotion as an indicator of illness. Sometimes we need to really pay attention to the context clues in those situations to tease those apart. The other tip I would have as you talk together is to really invite calm, open conversations. I feel like the conversation around COVID changes every day. We have more information, and especially depending on where you live, um, and communities that you might belong to, there's different information for different people, and there might be a lot of thoughts and feelings about that for your child or teenager. So what we want to do is encourage as calm as we possible these open conversations about what's happening. We want to avoid that just like over reassurance, like it's gonna be fine, it's gonna be fine, it's gonna be fine, without having that open conversation to allow room for discussion, because it's not helpful. And we might also have our own big emotions as adults and people in this world. So this gives us an opportunity to model coping with those emotions rather than just mastery over them. So it's not helpful for youth to hear like, I never feel sad about this. I'm fine about it. Like it's totally cool. Like I'm not sad, I'm not anxious. I'm just, bucking up and going to work. Because especially if your youth is having like a stronger, bigger, less, you know, positive emotional reaction to the situation, it just makes them feel more alienated rather than showing them that like it's like I'm supposed to feel fine with this, but that's not my experience. So it leaves them feeling more alone. So instead, we want to just be real about how we're experiencing the emotion, even if it isn't like a total match to their experience. So you might be thinking something like, "Oof, I'm noticing that I'm starting to feel a little worried about like this Delta variant, and I just don't know exactly what the school procedures are going to be like. But I'm remembering that I think, at open house, we're going to have an opportunity to discuss what the safety measures will be. And I wonder if that would help give me some more information to help me feel better or something like that." So it's talking through and normalizing that emotion and really kind of walking through the steps for how you are adaptively coping with those big emotions. And we want to encourage our youth to stay in the conversation, stay in the kind of move forward, I guess, with honesty in our discussion. So we want to be transparent with them. There's nothing we want to necessarily hide or obfuscate. We want to be as honest as possible. And it just might be that the specific language that you use varies depending on the kid's age. Um, as it comes to talking about these big things that are going on in the world, I often encourage parents to discuss what's going on as much as your kid is interested in it and as much as they need to know for whatever the situation is that they're going into. So that means that we don't have to find, the 5-year-old level language for all of the big details about COVID, because most 5-year-olds are not going to be interested or need to know all of those details for the situations that they're going to find themselves in. But it's important for them to have some understanding. In that conversation, it's also going to be helpful to name anxiety or other big emotions as they come up. So I have some families give anxiety or the other emotions that they're dealing with. So sometimes that's sadness, sometimes that's anger, to give it a name. And that starts to help them externalize that emotion. So then, especially if it's starting to become a problem that's getting in the way of what they need to do or want to do, then we can sort of be a team against the problem of, whatever they want to name it. I have kids name it Voldemort or the worry bug or all kinds of things. And so then we're the family team against the problem rather than the kid feeling like parents or other caregivers are ganging up against them because it's their emotion. And in those conversations, as we say, like, hey, that sounds like that's anxiety right there, we can also, that's an opening for us to help them become critical consumers of their own thoughts. To say, like, how true is that thought? How helpful is that thought really? Sometimes kids need more information to really evaluate how true their thoughts are because they just have missing details. And that would be an appropriate place for us to, jump in with the information that we know. And it also gives us a chance to encourage them to hang on to more helpful or true thoughts that they can bring with them as they walk in the door to school. So if they're really worried, like, I'm going to get COVID at school, it's like, Well, I can't promise that you won't because I can't predict the future, right? But maybe there are more true or helpful thoughts to hang on to, right? So, helpful thoughts about these are the safety precautions I'm taking. And then here's what the lowered risk is if I use the safety precautions relative to if we had not been doing it at all. So those are some top tips in terms of like how you talk to your kids about kind of setting them up for success and getting in the door to school. But most importantly, as it comes to anxiety, the critical element especially is to help them face the feared situation. In the cognitive behavioral therapy model, this is known as doing an exposure. So, with anxiety being one of the primary drivers of difficulty getting back in the door to school, um, I think this is really important to know that helping them do the hard thing of facing their fear is the critical element to tackling anxiety. That is the most important thing. And I would argue that even if it's something like just I hate school, or it's hard for me for other reasons that are have maybe more to do with learning, like it's just hard to sustain my attention or something like that. The key element is to practice doing the hard thing rather than avoiding the hard thing. So even though I'm talking a lot about this from an anxiety lens, we can generalize that a bit more to say that the intervention is to practice doing the hard thing so that we can have new learning experiences, that we can handle this, that we can essentially train ourselves to do the thing that's hard, which might be tolerating that big emotion like anxiety. And it might be something else, like it gives us new skills and that we, have new actual academic learning that helps us be more successful in that setting. As it comes to anxiety, though, facing our fears also means that caregivers are often facing their fears. So I just want to put that out there that as we talk about your kids going to school, a lot of caregivers might be facing their own fears about their kids going to school too. Next slide. So what we're doing is we're changing this cycle from one of avoidance, where we encounter a feared situation, kid feels anxious, they avoid it, adult steps in to rescue them, like, okay, we don't have to go to school, this is too hard. Everyone's anxiety comes down, everyone feels better. But then avoidance is reinforced. So then we've taught ourselves, I can't do this, this is too hard. And so then we're less likely to do it next time. Our anxiety is even greater the next time we approach that situation, which for school is an everyday occurrence, right? So every day matters in that regard. So the cycle of approach is one where the child encounters feared situation, kid experiences anxiety. We would expect that, right? Because there's unfortunately nothing magic about it, but also there's nothing dangerous about anxiety. So kid experiences anxiety, they make an attempt, a step to face the feared situation. I want to note that it may not be our end goal, but it's a step in that direction. We want the adults in that situation, that meaning the parents, or other caregivers, the school support team, to support the youth in facing that fear rather than helping them avoid. Everyone's going to be anxious about it because even us as adults, we don't like to make kids anxious, especially parents. We are adaptively built to rescue our kids from anxiety. So this kind of goes against the parenting brain. But the key for understanding why that's okay is knowing that this is a false alarm, right? So this is a false alarm that your kid is saying like, no, get out of the building, evacuate. If we keep listening to that, we're going to keep reinforcing that false alarm. So instead, even though everybody feels anxious, we're going to stay in the situation. Over time, our anxiety goes down because we have this new learning experience that, like, hey, actually, I could do it, right? Bravery was reinforced in that new learning. And sometimes we also reinforce with praise and rewards and other things to keep youth coming back to the door of school, so to speak. Next slide. Okay, so how do you face your fears? How do you do this? This depends on the fear or worry. As it comes to just like going to school, sometimes we practice just doing that even before the first day. And we've been calling this a dry run for day one, right? So that means, say school starts in a week from now. That means every day we're gonna, pack up our backpack, and we're going to get in the car and we're going to drive to the school, and we're at least going to walk up the doors to, or the steps to the school, to the door of school, or we're going to get as close as we can, given, whatever other barriers might be in place. What can we do to kind of approximate what that first day is going to look like? And that just helps us give us practice, so it's not like a ton of new stuff on the first day. And we have all of those previous experiences to say like, hey, I survived, I can do this. It's just like when I practiced this yesterday. We can also practice doing other things, like practice getting answers wrong. We do this all the time, right? Where we do practice, doing trivia with kids, where we're like, you're on purpose, I want you to answer all the questions incorrectly. Or we give them questions that they're just not so likely to answer correctly in the first place. Sometimes they practice getting it wrong on their own, and that's enough. Sometimes they need to practice getting it wrong in front of other people, knowing that we all make mistakes. So this is not an unusual life experience. Sometimes we need to practice doing things like talking to other people. So we go, through the Starbucks drive-through, or we, go to the grocery store, or the other places that are safe for you given the pandemic and your community, to find people to practice talking to. This over the pandemic, we've had to get creative, right? So sometimes we're walking around the neighborhood and just like waving and saying hi to people that pass by, or have had kids, shout out compliments or other things to the people as they've gone by. We need to practice wearing masks around other people, or looking at people wearing masks, that sort of thing. So it just depends on what the specific fear or worry is, and us getting creative about a way to face that. Next slide. So the key to being a supportive caregiver, and this is from Ellie Leibowitz's work, is this combination of validation and confidence. So this is that refrain of, I know this is hard and I know you can do it. Where parents or caregivers tend to get stuck is if they just fall in one or the other of those categories of either this is hard, oh no, this is hard, or the confidence of like, get in there, I know you can do it, get in there. We really need those two things to be combined for it to say, I get that this is hard. I know you're anxious in this situation, and I know that you can do it. Let's find a step forward. Next slide. So as caregivers, I just want to remember, as we get up to the first days of school, for you all to know that you set the tone. So how you talk about things in front of your child matters. So you might have lots of feelings about masks or the vaccine, or how people might be talking about COVID. And I just want to point out that how you talk about these things will set the tone for how your child approaches these things when they need to go to school. So that's key. So talking about it in a way that's going to help them adaptively be in the situation, follow the appropriate safety protocols, and still attend school if that's the decision you've made for your family. How you feel about that tends to start in the family conversation. And it also matters what you model with your behavior, whether has anything to do with the safety protocols, but also just in terms of how you model that balance of safety and approach, right? Like being safe, wearing a mask, and like still being able to walk around the neighborhood, or do the things that you have found to be and deemed to be safe given that risk calculation for you and your family, like getting groceries, that sort of thing. I just want to note, like, as caregivers, we're our kids' mirror. So they look to us to see how dangerous the world or this situation really is. And they look to us and how we look at them to evaluate how well they're expected to cope with this. So I think about this a lot in terms of like, if you handed a bite of food to your kid and you were like, here's this new dish. And as they brought the spoon up to the mouth, you were like, they're going to be like, what's in this? What are you trying to feed me? Right? So we really want to mirror, not only with our words, but with our body language, some confidence that they can do things that are hard, even though it's anxiety provoking. This is also all really hard for all of us. So making time to take care of yourself, to take breaks for yourself, to engage in that self-care is super important. And I know people have been talking about that a lot. But in terms of your kids coping, it's really important that you as caregivers take care of yourself first. So we can talk about that more if there are questions too. Next slide. Okay. And as kids face their fears, we want to remember to reward that with praise and rewards themselves, like privileges, or picking a game night, ordering dinner, prize box for younger kids, that sort of thing. Because the behaviors that you pay attention to are the things that are more likely to happen again. So we really want to shift to highlighting the doing the attention to their steps of doing the thing that's hard. Next slide. Okay. When it comes to anxiety at school, I just want to point out that often we've fallen into these pitfalls of accommodation. So accommodation is kind of this good word, bad word. So in schools, accommodation has often been kind of a good word, right? Like, here's how we're accommodating your student and their learning needs. When it comes to anxiety, though, accommodation is not a good word. So we do not want to be accommodating anxiety by listening to anxiety and making decisions based on what anxiety wants, because that keeps anxiety around. And so sometimes I see that accommodation is formalized into 504 plans or IEPs, like giving kids extra time, not calling on them, allowing them to get out of certain activities. And this is really dangerous, right? So if we're making this decision solely based on anxiety, then those accommodations are likely to perpetuate anxiety. So as we think about your kid getting back to school, I would not want there to be static or unchanging accommodations built into any sort of plan about anxiety that just facilitates this avoidance without any expectation of change. Also, things that I see that are in these plans a lot that are not necessarily bad, but not helpful, are things like relaxation strategies. So for a long time, relaxation strategies were billed as part of a primary intervention for anxiety. And what more recent research has shown is that not only are they not helpful to youth, but they actually slow down treatment progress. So we've stopped teaching them altogether. And they tend to actually reinforce this confusing message about anxiety, where we're like, anxiety is normal, it's totally adaptive, but calm your body down. Are you feeling anxious? Bring it down. So instead of sending that confusing message where they might accidentally become anxious about feeling anxious, we just want to help them become more mindful of their experience of anxiety and help them ride the wave to see that it goes up and it comes down over time. I also see journaling built into a lot of accommodation plans. It's not necessarily bad, it's just not a core intervention. So instead, we'd really want in these formal plans to have something built in that's more about taking specific steps to face fears, especially if it has to do with just school attendance itself, or talking to teachers, or other things like that. And I'd say the same is true if there are other things that are making it difficult to attend school. So say it's more behavior related, more of like an anger, I don't want people that, like, I'm angry that I have to do all this work, it's hard for me to sustain my attention. We're also likely to have a plan with a behavioral goal and some kind of a marker of what steps have we taken toward that behavior goal during this day, this week. That's going to be the more important intervention. But either way, we're going to need partnership from everybody in this sort of a plan. Okay, next slide. What I am hearing a lot is a lot of concern about anticipating that youth are going to refuse to attend school. So here are some things that I would say real quick for if you think that might be the case for you and your child. I would want there to be clear goals for attending school with an eye toward facing fears, listing out the steps between where we are now. So say school starts and they're like laying in bed, not getting out of bed, or some kids are making it to the parking lot but not into the building. So we want to list out the steps between where we are and where we're aiming, which is butt in chair in the classroom. So there might be some middle steps between where you are and where you want to end up. And I would really encourage some partnership with the school to come up with those. I want there to be a clear plan for what happens if you do go to school. So some clear rewards, that sort of thing, and some clear things that are known will happen if you don't go to school, which means like I tend to say that during school hours, you just don't get to like watch TV or like play your video games or have access to the other fun stuff during those school hours, because otherwise it will be kind of like an accidental reward for not going to school. And we want to have really clear criteria for sick days. You know, we've given the pandemic, schools are having very clear criteria for like what constitutes being ill. So I would adopt those, and rather than just like an I just don't feel good in general sort of idea, which again might be because of anxiety. We want to use your attention wisely, as we've talked about, and partner with the school on how they can support you with that goal setting. Next slide. So just wanted to give you an idea of a school to home note. So this is one way where we can set goals in collaboration with a teacher, for example, where there are goals about walking independently or whispering to a teacher or staying the full day. And especially for things where that might happen multiple times in the day, teachers can kind of keep a tally mark and send this note home either by email or a paper copy in a student's backpack to have some really clear communication with parents or other caregivers about meeting those goals. And then you can reinforce that at home. And then, maybe even send back the note the next day with a new goal to work on. And this tends to help people stay on the same page, working toward the same goals. Next slide. Okay, we did it. It's only 3 minutes over. So now I'd really like to open it up to some questions that you might have about any of this content.
All right, thank you so much, Dr. Reed. That was so incredibly helpful and so timely with school just having started for many families or starting up soon. I really appreciate your expertise in this area. So let's see for questions. One question is, how can we help our youth face more abstract fears or worries?
Sure.
On that.
Yeah, this is a really good question, because a lot of the times the things that our kids are worried about are not things that we can like ethically make them face in person, or we just don't have the power to make that happen, like the end of the world, or contracting a very deadly illness. So sometimes we instead look at ways that they might be avoiding normal activities that wouldn't, put them in any real like mortal danger. So we can kind of target it at some of that level of avoidance. And we can also do what are called imaginal exposures, where you write a story that's kind of like the worst case scenario that their brain is already thinking. And they read through that many times with the idea that they're making those thoughts less sticky, like a sticky note that you've picked up, 17 times and it just doesn't stick anymore. It just kind of like falls out of your brain. Another way I think about it is like if you watch The Exorcist, like the first time, you're going to jump at all the scary points. But if you just sit and watch it 60 times in a row, you would be so bored. You'd be like, all right, here's that thing. She's going to do this now. And it's just not going to be as scary. So that's the kind of the idea that we'd use for more abstract fears.
Thank you. It's really helpful. Another question that came up about the relaxation skills. So if parents aren't teaching kind of specific relaxation skills, how can parents help support their child kind of through an anxious period and help them kind of tolerate the wave?
Yeah. So I really like for parents to set this up ahead of time with kids, to talk about how our emotions come in big waves. And most kids can relate to that because they've, say, been to the ocean. Many of you are in California. And so they get the idea of waves. And so we can talk about how, the last time you were even really excited, you're probably not even that excited right now, right? So that emotion came in a wave. Or the last time you're really angry, are you still that level of angry right now? Probably not, because that emotion came in a wave. So the same thing happens with anxiety, where our anxiety goes up and then it's going to come down eventually, because otherwise the resources of our body will just, be totally spent and we'll need to take a nap. We'll just go to sleep. So we just what I would want parents to do is have that conversation and then just help their kids be mindful in that moment of like, here it is, there's anxiety. We're just going to hang out here. Yeah, it's totally okay for you to be anxious, right? And sometimes there are other behaviors that can come up during when kids are anxious, but we don't have to do anything to change that emotion, because to say that we had to do that would be to say that this emotion is bad, right? When in reality, it's a totally normal human emotion that we experience. So our goal is really just to help them stay and to say, like, you're doing a great job. Sometimes we have kids kind of rate how anxious they feel on a scale from 0 to 10 or something like that. So we can say, like, what's your number right now? It's looking like this is hard. So you might be 7. Whoa, it's at a 7. And you're still here. You're hanging in there. Nice job. So we want to focus on their function in that moment. Like, what are they doing, even though they feel really anxious? So a lot of times kids are still hanging in the situation, or at least a little bit, even if they've got one foot out the door, the one foot's still in the door. And that's what we want to focus on, so to speak. But I see that it tends to be a trap when parents chase calm. So if they chase the idea that your kid has to be calm, then we tend to fall into traps of accommodation where we're accidentally helping our kid escape or avoid situations that are anxiety provoking, or sending that message that we need to avoid the experience of anxiety itself.
Interesting. Yeah, thank you. And then let's see. And how is the advice you've been talking about different or the same if I'm mostly concerned about my child being more sad or depressed rather than anxious or worried?
Yeah, I think a lot of the general principle is the same, in that we want to practice what's called opposite action, right? Opposite to emotion action. So the more we listen to an emotion, the more likely that emotion is going to stick around. So the more we listen to anxiety and avoid, the more anxiety is going to stick around. The more we listen to sadness and withdraw, the more sadness or depression is going to stick around. So I think that's the general similarity in the advice here. Mm-hmm. I would want to make sure that the language that I'm using around emotions matches the experience of my child or adolescent in that situation. Mm-hmm. So if they're not, it's they're I'm not anxious, I'm just feeling really down, I'm feeling really sad, I'm feeling depressed. Mm-hmm. We want to use that language when we talk about it and say, I hear you, you're feeling really depressed right now. Let's practice getting out of bed. Because the more we, and setting some goals around that, what we call behavioral activation of doing the opposite of what depression wants you to do, which is stay away, stay in bed, not talk to anybody, mm-hmm. that sort of thing. Mm-hmm. And some of the same ideas around, holding on to thoughts that are more true or more helpful in a situation, that would also be a similar tack you could take for sadness or depression in this situation.
Mm-hmm. Mm-hmm. Yeah, great, fantastic. Thank you so much. And maybe we have time for just one last question. How can parents partner with their child's school to help if they're avoiding attending school?
Yeah, I think this varies a lot by school setup, but I would reach out to the school. Sometimes it's directly to a teacher, sometimes it's to a school counselor or the principal or vice principal. If really anybody, sometimes I recommend CCing everybody on that email, just or calling them all to make sure that somebody's definitely going to get back to you. But I think the key thing is to have a meeting where we're really clear about what's happening. So, Joey's having a hard time getting into school because he is really scared about about COVID, for example. Then we want to say, here we're getting stuck in the parking lot. Sometimes, so having everybody be on the same page about what the problem is, and the idea that we're going to set some goals to get to the end goal of button share in the classroom, so that I would really want schools to help us brainstorm about how could they support at what level. So sometimes schools are well, we can't really get your kid out of the car, but we can maybe meet you at the car and we can talk together and we can help us walk in with him. We sometimes schools will identify some like intermediate places for kids to hang out before they can get to the classroom. So maybe a first step is just to get to the conference room, which, conference rooms aren't used very much these days for group meetings. So maybe they get to the conference room in the main office and they hang out there for 20 minutes. And then the goal is to take another step toward the classroom, that sort of thing. So schools can be really helpful in helping us identify those intermediate steps, and just making sure that everybody's using the same language. We're on the same page about this idea of encouraging, rather than making any other kinds of comments that might work against our goals. That would be the key thing to do, and also some way that you can get regular feedback, especially once kids are in the door and you don't really know what's happening at school. So some system of communication, whether it's just check boxes. I've had parents create some great like Google Forms or like red cap surveys that they send out to teachers and other school personnel so that they hear every day, what are the specific things that ended up happening for their student that day.
Mm. Yeah, that's wonderful. Thank you so much for those ideas.
Sure.
All right, well, thank you everyone.